I could comment on our speakers, but I don't want to do that because there are a number of key questions. And I also want to invite the speakers to ask each other questions. But let me start with one question that really fits all three of you, but let you see who wants to jump in first. And I think that Cheryl's been talking some about this. How do we use financing to remove the barriers to relationship, empathic and trust-based processes? How do we remove those barriers that get in the way of that to produce health and well-being? Use financing. How do we use financing to do that? And
well, I can address it from my perspective. And this goes back to I think it was the last panel, and developing trust and the relationships and a lot of, at least practices at the private practice level, they don't have the funds for the practice infrastructure to reach out in that way, to create that kind of trust. It takes resources to do that, to create those relationships. And if you're just trying to do a volume-based system, you're dying just trying to keep up with your overhead costs. So the financing needs to address the infrastructure in order to create the trust and the relationships that are necessary to address all these other non-medical issues.
And I would just comment and say, just to build on what David said, we know, right, I think we all look at the literature, we know that people trust people who are like them and from their communities. And so part of this is ensuring that there's cultural concordance, understanding, and so that they're the things that are unsaid in any communication. I recall many times early in my career where I may not have said to someone, hey, I actually know the cost of this medicine and can you afford it? I think that those are important pieces in a community where the people who are serving in that community ensure that they understand that those are issues and that they're addressing them up front, not waiting for someone to leave, go home, and then realize there's this gap. And so there's a piece here of ensuring healthcare for that community. And that's what we say, zip code more important than genetic code. I think the other piece of this is ensuring that we're approaching healthcare in that holistic manner. We, when I trained, did not ask people about behavioral health and mental health. We now make it a requirement. We did not always ask people about, do they have food? Did not always understand if it was a safe environment for you to exercise. It's like, telling someone to go home and walk a mile and you should have a diet and recommending cottage cheese, not understanding lactose intolerant for the person that you're caring for. So I do think there is an awareness and knowledge that we have to have, and then ensure that we're also being sensitive to the people who we're communicating with and listening to them of where their priorities are. It allows you to not only build trust, but it allows you to be efficacious. So you're not coming up with plans that can't be implemented by someone.
Thank you so much, Cheryl. Dexter, did you want to add to that?
I was just going to say that there's another element of trust when it comes to finance, and that is that, there are two old sayings. You follow the money and you get what you pay for. And one of the things is that we are paying for the wrong kinds of, North Stars, so to speak, I think. We're still paying for, you do more, you get paid more, fee for service for the most part. And so when you pay for that, you really haven't aligned incentives with what we're really trying to do, and that is to get people healthy. And then you have to manage that. You have to then have this oversight because everyone is trying to maximize their gain with the way that we're paying them, right? And if you go to capitated systems, then you get paid more if you do less. And so we have to manage that so that they don't do too little, that they do what's right. But if you think about it, if you really align the incentives in the way that I think we can, you have to do less of that management, and therefore you have more trust because we're all trying to move in the same direction. We don't have to watch each other's backs or look over our shoulders to make sure that we maximize whatever we can get out of this because we're all moving in the same direction. So that's the other element of trust that I would just add to the conversation.
Thank you so much, Dexter. Here's a question for Cheryl. How do Walmart clinics connect with primary care physicians in communities to prevent fragmentation of care?
Yeah, it's a great question. And so our centers are actually primary care centers. These are physicians who are in the community, from the community, and they're providing care. Usually our centers are open 7 days a week. So they are part of the healthcare community, and they are able to work and partner with the referral network within a community, and also partner to ensure that someone can get all of the other services they need in that one visit. And so you may see your primary care physician and you may have diabetes, if I use that as an example. Well, you may need to be taught how to utilize finger sticks at home. You may have a different monitoring tool, and you also may be looking at how do you collect that information, be it in a smartphone or in a data log. In our primary care clinics, we actually have community health workers, care coordinators. We partner with pharmacists, as well as ensuring that there is dental and optical care. So a patient coming in with diabetes can have many of their needs met, all within one center, where that primary care physician is your physician always and always available and able to connect you with other referral networks that you may need. Might just mention the comment from Dexter and from David. We also believe in this omni-channel value-based care and not a point-by-point care. So it's really, how do you care for an individual and how do you provide all of the services that they need to remain healthy?
Thank you so much, Cheryl. And I'm hearing from what you're saying, and we heard this earlier today in the other panels, the importance of changing the workforce and finding a way to finance that workforce. And I'm wondering, you've mentioned that you're using community workers and so forth. You're adding those workers. And I'm wondering if Dr. Sherney has thoughts about how to work to expand the workforce. So there are the people who can make those visits to a person's home, as we heard earlier, that might be more than 9 times a year if needed. And so I'll ask that, and we have a couple more questions, and then I think we'll be wrapping things up a bit.
Absolutely.
So Dexter, look at
yeah,
that.
Absolutely. I think that's the way to go. And there have been studies that have shown that these community workers can really add value. For one thing is that they come from the communities that they're working in. So to Cheryl's earlier point about, are my healthcare workers or whatever, do they look like me? Adds this other element of trust, right? So because now these are the folks out there working with these individuals that come from and look like them. The other thing is that it gives back to the communities too, because now you're hiring from these communities. So that raises the economic potential of those communities that they're coming from and serving as well. So it's a win-win. And I really applaud Cheryl and Walmart for this good work.
Margaret, I'd just like to
David.
add a quick thing about that. This is
Absolutely.
so important, the engagement of the community and also the healthcare staff. And if you heard Ben Kligler from the Veterans Administration talk in the last session, that is a key part of their whole health strategy, that they're getting their whole healthcare workers and providers into the whole health program in addition, as well as using peers, veteran peers, to actually be engaging the patients. So it's just a key thing, and that needs to be really accelerated, I think.
I would just comment on that you think about rolling out COVID-19 vaccines over 1.5 million people, beyond everything that you're doing in the community. The most important impact has been when someone who is a greeter at the door goes back into their group, and be it the meeting room or where everyone's hanging out, and says, I just got my vaccine. It's much more than the EVP saying you should get your vaccine. That communication and that closeness and connection really matters. And we've seen it over and over in our community programs.
Thank you so
Yeah.
much. It's so true. Sure, go ahead.
No, I was just going to say, it really all comes down to trust. I'm actually preparing for another panel that I'm serving on, and we're going to talk about fake news, or myths, and debunking these kinds of things. And what we're finding out, and as I prepare for this, I'm finding out that it's really about trust. It goes back to trust, that people are not going to trust people that they're not going to trust the information that comes from people that they do not trust. And so therefore, we really have to start to, if we're going to get through some of these things, like, the fake news around COVID-19, do I take the vaccination or not? Cheryl and I and David, we can talk all day long about this stuff, and we can show all the facts, and the CDC can as well. But if it's not coming from somebody that they inherently trust, then it's not going to resonate, because they'll just see this as something else. So I just wanted to reinforce that.
And the financing has to facilitate practices to be able to know how to do that with their community. It's not just intuitive. It requires training and operationalizing that, and it has to be paid for by somebody. So
I think, David, comes back to why value-based care really fits a model that uses a team-based approach and allows you to use the best resource to provide that care and improve someone's health and overall lowering healthcare costs, as Dexter pointed out.
This has been wonderful. And I'm hoping that everyone is also picking up on the point that with employers that we're hearing from, they play a major role in the overall community, and employers can play that role. They're not, because employers have families, and they're in communities, and we're hearing from employers who are doing that. I want to mention something else, because I know there are people that joined us today that weren't here at the first day of the workshop. And that was another thing that came from the work at the Veterans Administration's Whole Health Program. It was emphasized by Ben Kligler when he spoke about really making this all personal. David's mentioned that some of the people that work with veterans are veterans who are coaches and other people who the veterans trusts. But another thing that they do, and this gets to that patient-centered approach that others have mentioned today, and that is to ask patients what they need their health for, to find out what is their purpose in life, what is it they want to do. I remember this so vividly when talking to seniors, and really not just treating disease, but asking them what was important. And what was important is they wanted to be able to pick up their grandchildren. They wanted to be able to see their grandchildren, and they weren't able to do that because of some of their health conditions. And so that motivated them. So it's that patient center, finding that purpose, but people will only tell you their purpose if they trust you. We have a tough question for Dexter, I think, but I know he can handle it. Let me go to that right now. This is from the audience. Dr. Cherney's premise is that one cannot substantially lower the cost of care by managing care, which only drives 15% of health outcomes. The key to reducing the cost of care is guiding the patient population to not need health care. The funding problem is that health systems don't adequately value health. It only values the treatment of disease. So is that something, Dexter, you could talk about, and how also the decision that your company has made in terms of using external incentives as motivators appropriate to improve healthcare and outcomes, rather than reaching that intrinsic motivation, because you're in a position to reduce costs of their healthcare and so forth. So I'd like you to talk a little about those issues.
Well, intrinsic motive, I love that question. It has a couple different parts. I hope I'll catch them all, but intrinsic motivation is key. And to your point earlier, Margaret, about asking the patient, what do they really want to achieve in their health? That is so important. And that's really where I think lifestyle medicine and some of the things that Dr. Fogel was talking about can play such a key role. So for example, one of the places where I start with lifestyle medicine with individuals is around the sleep domain. 85% of us, according to some surveys, are sleep deprived. I mean, it's a big thing. You get on an airplane and before the thing even gets out the gate, people are falling asleep. That should not happen. That means that we are sleep deprived. And so one of the lifestyle medicine tenets is to really show people how to get a more restful night of sleep. We can't put more hours in the day, but we can certainly show you how to get a more quality sleep. When you do that for somebody, and that's a pretty rapid benefit, they feel better within days. That becomes motivating to them. Then they're interested in what else you might recommend for them as well. So you catch them where they are, whether it's sleep or something else, whether it's their brain health and they're reducing their risk of having dementia. They'll all sleep in lifestyle. And so you can really get people's attention and start them to move in this direction on their own. Then what you do is you then incentivize the physician or the providers to match where the patient already wants to go. And so that's how you start to bring in these provider incentives that the person was asking the question about as well. And then, of course, you have to have the overall incentives that you're really getting paid for the population's health and not just how much energy you're churning day in and day out, but are you really moving the needle and really base more value on those? And we're starting to get there, but I hope that starts to answer that person's question.
Thank you so much. I now just want to thank the panelists. And I'll note that David Fogel said earlier, change occurs when trailblazers find one another and join forces. And I think you've just heard from 3 trailblazers. Thank you so very much. And I'll turn it now back to Keisha.